Hello, and welcome to the Dance Physio Podcast, a podcast designed to explore ideas and foster discussion around dancer health and wellness. We're here to challenge the status quo, bridge the gap between dance science and the studio, and help change the landscape of the dance industry for the better. I'm your host, Erika Mayall, a dancer turned physiotherapist who is deeply passionate about leaving the dance world better than I found it. I'm so glad you're here. Let's get started.
Hello, everyone, and welcome back to another episode of the Dance Physio Podcast. Before we dive into today's podcast episode, I just want to let all the dance teachers out there know that I am going to be running another round of my Flexibility Foundations course coming up this fall. So that is my course that's all about training flexibility in dancers in a way that encompasses and honors the nervous system. So if this is something that you're interested in terms of learning more about flexibility and how we can harness the power of the nervous system to improve flexibility in our dancers, I have a waitlist open right now. You'll be the first to hear about dates of the course, first opportunity to register for the course, also get a discount on registration, and there's going to be some other bonuses for people on the waitlist as well. So obviously there is no obligation to actually register for the course, but if you want to be on the waitlist to be the first to hear all of the details, I will drop the waitlist sign up in the show notes, and you can head on over there or on my Instagram in my bio. There is a link to the waitlist as well. So throw your name on the waitlist and you will not miss any of the details. So without further ado, I'm going to get into today's podcast episode. I want to talk all about knee hyperextension today. And I was going to generally do an episode more about just kind of like general kind of hyperextension and hypermobility. And I will at some point do podcast episodes about that. But that's such an in-depth topic that I wanted to pull out this one specific piece and really tackle it because I've been getting a few questions about specifically knee hyperextension. So to be really clear before we dive into the content of this podcast episode, I am not necessarily talking about people with more global hypermobility disorders or connective tissue disorders like Ehlers-Danlos and things like that in this podcast episode. People who fall into those categories may also have hyperextension at their knees, and so this information applies to them as well, but it is quite common for us to see dancers who have hyperextension at their knees that it's not related to any sort of more overall global joint hypermobility or hypermobility syndromes or anything like that. So I just want to make that abundantly clear that this information, although may pertain to our hypermobile population, it is not exclusive to that population because it is common that we see hyperextension in other dancers as well, and their knees might be the only joint in their body that they have hyperextension in, or they might have it in one or two joints. So maybe their knees and their elbows hyperextend, but nowhere else in their body, and they don't have what we would consider like global or more generalized joint hypermobility. So when we're actually talking about hyperextension at the knee, what exactly are we talking about? I think everybody kind of has a vague idea of like what that actually means, but in sort of a more anatomical terms or from an anatomical lens, what we are looking at is a knee joint that extends beyond 0 degrees. So if we have a leg that's fully straight and it's just like straight up and down, completely vertical, we would term that to be like 0 degrees. So a straight line being 0 degrees. And then if somebody bends their knee to say 90 degrees, then that is how we would call that. So when we talk about degrees of knee flexion, we are starting with the leg being straight sort of at 0 degrees and then flexing from there is generally how most people will talk about the mobility at the knee joint. So if we have a knee that goes beyond that 0 degrees, so as we straighten it, the knee actually kind of starts to bend backwards a little bit, we would deem that hyperextension. And you'll sometimes, if you see it like written down, you'll see that sometimes there's a degree of motion attached to that as well. And most commonly, like if we're just like using like notation or annotation to like denote this, it's going to be like a -5 degrees or -10 degrees. And what that means is it's like 5 degrees of hyperextension or 10 degrees of hyperextension. So that's the like degrees that go beyond the knee being completely straight. So just from an anatomical lens, I think, like I said, in practice, most people have like a visual of what this looks like, whether they have hyperextended knees or have seen dancers with knee hyperextension. But in terms of like, what are we actually looking at? What are we actually measuring? That's sort of where this comes from. It is quite common for a lot of the population to have a small degree of hyperextension in through there. So if we're measuring like knee range of motion or knee mobility in people, we will often see that people might have 3, 4, even 5 degrees of hyperextension is pretty common within the general population. But we often in the dance population will see significantly more than that. So we may see 10 degrees of hyperextension or 15 degrees of hyperextension, and we can get into a lot of hyperextension within the dance population. So we are going to talk today kind of from two different angles about this, because I feel like knee hyperextension is something that if you don't have it, you really, really want it. I often get dancers, especially like younger dancers, coming into the clinic and being like, I want to improve my knee hyperextension, or I want to try and make my knees be able to hyperextend. So I feel like it's something that some dancers struggle with, in that it's something they want to try and achieve. So if they don't have it, it's something they want to work towards. And then on the opposite end of the spectrum, dancers who have a lot of hyperextension in their knees, it's something that they often struggle with controlling. And so if they have that hyperextension, they maybe potentially don't want that hyperextension in through there. So it's kind of one of those like paradigms of like, if it's something you don't have, you want it. But if it's something you want, you don't have it. Did that make sense? Anyway, you know what I mean. So we're going to start with the people who do not naturally have hyperextension in their knees and come in sort of like desiring that. And you used to see online, I mean, I'm sure they're still out there. I just like very purposely don't look for this like information, but like you would see these like horrendous videos of teachers or coaches. You'd see it in like rhythmic gymnastics and stuff too, of people like sitting on young kids' knees with their feet propped up like on a chair or something like that, trying to force the knees into like a hyperextended position. And this is so, so, so scary for so many reasons. And one of the reasons is that when it comes to extension at the knee joint and whether we have hyperextension or not, that often comes down to our bony morphology. So it's one of those things that like we're either built that way or we're not built that way. And so if we do not naturally have hyperextension that is happening at the knee joint, we don't want to try and force our knees into those positions or try to gain that mobility in through there. And there's a few different reasons for that, but the main reason is on the back of our knee, or our knee joint in general. The knee joint is like a hinge joint. So you can think of it just as like a simple hinge. So it flexes and it extends. There's a small amount of rotation that happens in the knee joint as well that we call it conjunct rotation. But for today's discussion, we're just going to think of it as a hinge joint, and it flexes and it extends. And when we get to that limit of extension, so the knee is fully straight, there isn't really anything from a bony perspective on the back of the knee that stops that motion from happening. The structures on the back of the knee that kind of limit our extension in through there, once we get to the limit of like the joint movement, are soft tissue structures. So we have our joint capsule, we have ligaments, then we have like tendons and muscles that run along the back of the knee as well. There's also nerves and blood vessels and all sorts of other structures. But the ones that we're most concerned about are the joint capsule and the ligaments in through there. And if we start to try and sort of forcefully gain hyperextension in our knees by doing all sorts of extreme things like, having somebody sit on your legs when they're like hanging off a coffee table or things like that, we actually start to stretch out and damage those structures in the back of the knee that are controlling that mobility in through there. And if we start to stretch out and damage those structures, those changes are permanent. So when we are talking about stretching out a joint capsule or ligaments or things like that, it's not like we're stretching a muscle and the muscle is really elastic. Those structures are made out of more solid connective tissues. They're more fibrous. And when they stretch out, or if we, tear them or something like that, those changes that happen are permanent changes, and we can then destabilize the joint and cause a lot of stability issues within the joint if we are artificially stretching out those structures in through there. I talk a little bit more about this in the podcast episode. I believe it is episode 12. That's all about overstretching. I did a series on like flexibility. So if this is something you're interested in learning more about and you haven't listened to that podcast episode yet, I would encourage you to go back and listen to episode 12. I'll link it in the show notes here as well, because I do get into a little bit more about like why we don't want to like hang off of our ligaments and our joints and that sort of thing. So the same holds true for that knee joint in trying to like increase that hyperextension in through there. So it's really important that we know and remember that we don't want to try to force hyperextension in our knees. So it is one of those things that like potentially you have knees that do naturally hyperextend and other people are going to have knees that don't necessarily naturally hyperextend. And that just is how we are. And we learn to dance with and use our body in the way it is, as opposed to trying to structurally change things and cause potential issues down the road. That being said, there are people who come into the clinic and say, you know, one of the things I want to work on is being able to straighten my knees, because one of the corrections I always get in class is that my teachers tell me that I'm not like fully straightening my knees, or my knees look bent, or things like that. And so there are instances where we can actually work on knee extension if it is not the joint itself. So it's not the actual bony structure that is limiting it. And so if you are somebody who struggles with like getting your knee straight, or like you're getting that correction a lot and you're kind of like, I don't know if I like have hyperextension and I just don't know how to like fully extend my leg, or if it's like my bone structure that's preventing this from happening, I do encourage you to go and see a healthcare professional who can actually like assess the amount of mobility in the joint and tell you what it is that's limiting that. Because it's common that we get dancers who come in and they are maybe struggling with getting their knee straight, and they're always getting, you know, comments that your knees always look slightly bent, even though they think they're fully straightening them. And they actually do have the mobility in the joint to be able to either get their knee fully straight, so to that 0 degrees, or even sometimes they'll have a couple of degrees of hyperextension, but they might be struggling with how to access that mobility. And this can come from a few different reasons. It can be structures that are too tight. And in this case, I'm talking more about like muscular or tendinous structures. So one of the common reasons that we'll see is the hamstring crosses the back of the knee joint. So if we're really tight in our hamstrings, it can make it hard for us to straighten our knee fully. Or our calf muscle, our gastroc muscle, gastrocnemius, it actually crosses the back of the knee joint as well. And a lot of people don't realize that. Like people kind of assume it's just on the back of your calf, but the attachment points for our gastrocs are actually above our knee joint. And so that can also influence our ability to fully straighten our knee. So structures through the back of the knee can be sort of tight and a bit restrictive, and that can make it really hard to straighten the knee or get sort of like that kind of like long straight line that we are often looking for in dance. And one of the other reasons can be a little bit of weakness in the quad muscle through the front of the knee. So sometimes it's like, you know, passively we can straighten the knee, no problem. There's no restriction in the musculature, like everything feels fine, but the dancer just struggles to have enough strength in their quad to keep their knee fully straight, especially if the leg is like a longer lever. So if you're doing something that's like a kick or something where your leg's extended away from you, as the leg moves further away from the body, that lever becomes like longer, and the weight of the leg kind of increases sort of relatively, and it can make it really hard for that quad muscle to keep that knee really straight. So sometimes when we are looking at dancers trying to attain a little bit more of an extended or like straight line look in their knee, we can improve on that by working on potentially quad strengthening or lengthening through the hamstrings or lengthening through the calf muscles or things like that. So it is not to say that if this is something that you struggle with, that, you know, like all hope is lost necessarily, but it is important to know what it is that is limiting the straightening in your knee. And is it your joint mobility, in which case we are not going to be able to change that for the most part? or is it more soft tissue structures that we can have an influence over? So those are kind of the most common things that we'll see in these dancers who want to have some hyperextension in their knees, but maybe potentially don't or haven't been able to access full extension. So now I'm going to move on to what most dancers, or maybe not even dancers, but what most teachers struggle with is how do we work with these dancers that have these hyperextended knees? So these are dancers, again, probably not so much your dancers that maybe only have 3 or 4 degrees of knee hyperextension, but often dancers who have 8 degrees, 10 degrees, maybe even 15 degrees, like a lot of hyperextension in the knees. And this can be hard to deal with because it can be hard for dancers to control. And there have been some conflicting schools of thought in the dance world about whether we should or should not allow dancers to exploit this hyperextension that they have available to them. And there are some genres and forms of dance that really highly covet large amounts of hyperextension. And so some of the classical ballet forms and things like that, they really like the lines that are created with some hyperextension in the knees. And so do we allow dancers then to exploit that hyperextension for the sake of the lines and the sake of the artistry or what have you? Or do we, not allow dancers to do that, potentially for the sake of their health and safety? So we're going to get into a little bit of why we may or may not allow dancers to access their hypermobility and sort of how we train with hypermobility and that sort of thing. So definitely having hyperextension in the knee can be a hard thing to learn how to control. And it's something that, especially for little kids, we want to start to teach them about early, because if we aren't recognizing it with younger kids or aren't aware of it and are just allowing them to sort of potentially sink into their hypermobility or kind of exploit that hyperextension, it becomes a lot harder to learn to control it as you're older. We want to try and teach kids from as young an age as possible to kind of control that hyperextension that they have. And so from a health and safety perspective, we don't necessarily want dancers to exploit the hyperextension that they have. And we'll often refer to it as kind of sinking into the joint. So you'll see dancers who kind of just lock their knee into that hyperextended position and rely on that hyperextension just to kind of sit into or sink into the joint in through there. And for the same reasons that we don't want to force hyperextension on people's knees that don't naturally hyperextend, we don't want to let knees that do hyperextend sit into those positions. So like I was explaining before, if we are in that hyperextended position, we're stretching out or relying on all of those structures on the back of the knee, the joint capsule, the ligaments, the tendons, everything that crosses the back of the knee. And if we're just allowing dancers to kind of sink into that or really rely on those structures to sort of control the knee and aren't using any sort of muscular control around the knee to control that, we can over time start to stretch out those structures and create more instability and create possibly more hyperextension. But also we will often tend to irritate those tissues on the back of the knee. And so a lot of dancers will end up with pain in their knees because of sort of sitting into or not controlling that hyperextension in through there. So we really do want to teach dancers to be active in those extended positions and not just allow themselves to rely on that passive joint mobility where they're just sinking into the joints or sitting in the joints or whatever terminology or visual you want to use for that. Now, this becomes a little bit more complicated if we think about a supporting leg versus a gesture leg. So as a rule, and what I will teach dancers and dancers that I'm working with, what we'll kind of talk about is As a rule, we do not want to be exploiting our hyperextension in a weight-bearing leg. So if we are standing on our leg, and whether we're standing on two legs or standing on one leg, it doesn't really matter. If our leg is in a weight-bearing position, we want to be actively controlling that joint mobility in through there. If that leg is in a non-weight-bearing position, so if we've taken that leg off the ground and we're bringing it up into like an arabesque or into, it doesn't matter what position, but in a position where it has no weight going through it, then it is often okay for a dancer to use their full amount of hyperextension in this non-weight-bearing position. And sometimes we want that, again, for these like lines or for aesthetics. Sometimes it actually does look aesthetically more pleasing or like matches the choreography or whatever it is that we're looking at. And so we may allow dancers to use their full hyperextension if that leg is in a non-weight-bearing position. Now, this is a really hard thing for dancers to learn to differentiate and to be able to control, especially when we're moving through exercises like quickly or it's choreography or things like that. So this is not a concept that I introduced to, an 8-year-old, a 10-year-old, maybe even a 12-year-old dancer. In those populations, we really just want to work on them being able to control their hyperextension and not be like, passively sinking into or snapping back into that hyperextension in their knee joint. And I won't even give them that differentiation to say when there's no weight going through your leg, you are allowed to hyperextend. As dancers reach a more advanced level, so maybe as we get to like more vocational levels or dancers in a pre-professional setting or professional dancers, we will introduce this nuance of when your leg is non-weight bearing, you can, if it, is warranted, with whatever it is that you're doing, you can start to use that hyperextension to get those lines. But again, this is something that is like harder to learn and harder to control. So it is not something we're going to introduce at a really young age or for dancers who are still like really working on foundational technique type things in through there. So that's kind of my rule of thumb in terms of like whether dancers should or should not be allowed to kind of exploit their hyperextension. One of the questions I get asked really frequently, and you'll see, and again, there's like different schools of thought and people can get like a little bit up in arms about it sometimes, is with dancers specifically in, say, first position. So if you have dancers who have knees that hyperextend, do you allow them to have their heels apart from each other? So you'll see in some training methodologies and in some schools of thought where dancers in a first position will actually have their heels potentially miles apart from each other. You'll see some people, it's maybe their heels are only an inch apart, but you'll see some where their like heels might be 3 or 4 inches apart from each other. It's almost as if they're in a second position, but it's meant to be their first position. So I get that question of like, should we allow dancers to do that so that they can actually get their like legs together and kind of like get their knees touching and their inner thighs touching and all of that stuff? Or do we train dancers to have a first position where our heels are in contact with each other and then their knees are potentially going to be, quote unquote, slightly bent? They're not actually going to be bent. The dancer is going to feel like they're bent, but their knees are going to be in a more vertical position instead of being in that hyperextended position. And I definitely fall into the school of thought of we do not want to teach dancers to have their heels apart from each other in a first position. We want our dancers to have their heels together because we want to teach dancers how to find a straight line that is not a hyperextended line when they're in a weight-bearing position. And if we're allowing them to move their heels apart from each other, all we're allowing them to do is to sink into or to really like exploit that hyperextended range that they have in that first position. So if you look at their leg and you like measured it with goniometer, they'd be sitting in, say, 10 degrees of hyperextension. Their knee would not be in a vertically straight line. And this is not what we want to teach dancers. We want to teach dancers to control the hyperextension in their joint. So I always am training dancers to have their heels together because it is one of the ways that we can start to introduce a concept of what is your straight line, because it's not going to be it's not going to feel fully straight to them. They are going to feel like it is slightly bent because they are not at the end of their full range of motion. But that is where we want them to learn to be on a straight leg, is controlling that mobility in through there. Now, that being said, if we have a dancer who has like really, really, really extreme amounts of knee hyperextension, and this is like, I have seen this for sure, where dancers might have like 15 degrees of knee hyperextension, I may start with allowing this dancer to have their heels slightly apart from each other, because that is going to be probably less hyperextension than where their full hyperextension would be, and is like a way of kind of then training them into a more kind of vertical or neutral position. So if we have a dancer, and I'm just pulling out like random kind of numbers here just to give you a visual, but if you had a dancer who had 15 degrees of knee hyperextension, let's say hypothetically, if they were to have their knees and their inner thighs and everything touching, their heels may end up being 4 inches apart, let's say. So rather than saying, okay, we're going to go from 4 inches apart to having your heels directly touching each other, depending on how much they're struggling with learning to control their knees, you might need to start with saying, okay, your heels are going to be 2 inches apart from each other. So that's going to bring their knees into a less hyperextended position, but it's not necessarily fully correcting it off the bat, because that might be too much for them to learn how to control that from the beginning. So it is always going to be like individual to the dancer and a little bit nuanced, but general rule of thumb is we don't want to encourage dancers to just be like, oh yeah, like bring your heels apart from each other because it's going to be easier for you, because they're not then learning how to control that sort of hyperextension in through there. One of the other questions I get asked really commonly is like, how do you teach dancers to, find that neutral line, to control that hyperextension? Like, one of the things, so I have hyperextended knees. I don't have super hyperextended knees. I actually haven't measured it in a while. I don't know what it is, but let's say when I was a kid, it was less than 10 degrees. It was probably somewhere in the neighborhood of maybe 7 or 8 degrees. So it wasn't a huge amount, but it was enough to be noticeable. And the cueing that I used to get from some of my teachers when I was little that I remember is just that they would say, oh, just bend your knees a little bit so that they're not like, locking into hyperextension. So it was great that the teachers recognized that like we didn't want to exploit that hyperextension, but the cueing that I was given was basically just to like bend my knees, which wasn't overly helpful, because in a bent knee position, I'm not necessarily engaging the muscles in the same way we want them to be engaged if they're like our supporting leg. So what we need to teach dancers is this ability to find what I call like a co-contraction. So it's an engagement of the muscles on the front and the back of the leg at the same time to stabilize the leg, but that is not just like bend your knees, because then it's also like, well, bend them how much? Do I bend them a lot? Do I bend them a little bit? Am I just like sitting in a plie at all times? It's like really confusing, especially for younger kids. So when we're trying to teach dancers, okay, where is your straight line? What is that going to feel like for you? Because again, depending on how much hyperextension they have, they might only need just a tiny little bit of correction, and they might need a lot of correction. And for dancers who maybe only need a tiny bit of correction, sometimes a cue of just having their weight more over the balls of their feet instead of sitting into their heels is enough to bring them out of that hyperextended position. In some dancers, that's not going to work. That never worked for me. It wasn't a good cue. It wasn't until I learned some of this stuff later that I was like, oh, that's what I'm supposed to be engaging to control the hyperextension in my knees. So two of the sort of things that I will use with dancers to really feel this kind of engagement and this co-contraction. The first one that I use, and this one works really well, especially with like younger dancers, like all ages, but like if you have younger dancers, this is always like my go-to. And then again, like older dancers, it's totally fine with. I will start with dancers sitting on the floor with their legs out in front of them. And in this position, if we have a dancer who has hyperextension in their knee, and I'm sure all of you guys have seen this or done this before, but if we ask a dancer to, fully switch on their quad muscle or really straighten their knee, and they can have their foot pointed or flexed, it doesn't really matter, their foot, so their heel usually, so if their foot was in a flexed position, their heel will come off of the floor as they fully straighten their leg. And that's where that hyperextension is coming from. So their whole thigh is going to be still in contact with the floor, and then their heel is going to end up popping up, an inch off the floor, 2 inches off the floor, however far it comes up, depending on the degree of hyperextension that they have. So that's one way of testing if our dancer has hyperextension or not, is that little heel lift test. So if you fully engage and straighten your leg as much as you can, what happens to the foot? Does your heel come off the ground? Then we're going to ask the dancer to put their heel back on the ground, and we're going to ask them, and again, you can do this in a flexed or pointed foot position. I tend to do it in a flexed foot position, but it's totally up to you. You're going to ask the dancer to engage their quad again and really think about straightening their knee as much as they can. So same feeling that they had in the first little demonstration, but this time their heel is not allowed to come off the floor. So they're going to keep that heel pressed into the floor, or at least in contact with the floor. Sometimes I cue them to press it in. It depends on kind of what they're doing, how it's presenting. But you're going to cue them to keep that heel in contact with the floor, but they're still going to activate their quad muscle and really engage through their leg to find a straight line. And for dancers, this is going to be that sort of straight line, quote unquote, straight line that we are looking for, that their leg is in a neutral position, but it's that muscular activation. And if you ask them what they're feeling, they will feel activation in the front and the back of their leg most of the time. So that's kind of where I will start dancers, is literally learning to engage those muscles, but not letting the heel pop off the ground. Once dancers get good at that, you can get them to do that same engagement and then hold the engagement in their leg and lift their whole leg up off the ground, just an inch or two. So they're having to keep that co-contraction or that activation going through the leg to keep that knee joint stable and then move the leg up and down in those positions. I will try and do a little Instagram video on this over the next couple of weeks so that you see what I mean by this, from a more visual perspective, because I realize with words, this is kind of an awkward thing to describe, but hopefully you guys are getting the visual of what I mean by this. For one little kind of exercise or task that a dancer can do to really feel and learn the muscle engagement that we want for these knees to be kind of in this activated position as opposed to just exploiting that hyperextension. Another one that I will use more in standing, and this is a little bit more of a visual thing, although dancers will then feel the activation sort of required as well. But I will have dancers standing in front of a mirror and their feet directly parallel. And so a lot of dancers with knee hyperextension will tend to want to stand with their feet slightly externally rotated, or they'll kind of do funny things to try and fix their alignment of their lower legs. But for the purposes of this, we want them to have their feet very, very parallel. So their feet are going to be facing forwards, and we're not going to worry what their knees are doing to start with. You're then going to ask the dancer to sit into their hyperextension or fully straighten their knee. And what you will see is that there's a little bit of this rotation that happens when our knees fully straighten. And so, like I was saying before when I was talking about the knee being a hinge joint, there's a little bit of what we call conjunct rotation that happens at the knee joint when it straightens and when it bends. So if a dancer has knee hyperextension and their feet are fully parallel, as they fully straighten their knees, what will happen is their legs are going to internally rotate slightly, and their knees will generally start to face in towards each other. Their kneecaps will start to face in towards each other a little bit. So that's a totally normal position for those dancers to be in if they're standing with their knees hyperextended. Then what we're going to ask the dancers to do is find that same sort of co-contraction. So if you've done the exercise with them on the floor and they're familiar with that feeling, sometimes I'll just ask them to find that same feeling in their leg in standing. If either you haven't done that for some reason because you haven't been able to, or you're doing the standing one first or whatever, sometimes I'll use different cueing instead. And essentially what we will ask dancers to do is try and find the activation in your legs that allows your kneecaps to face forwards, but without moving your feet. And the only way that those dancers are going to be able to do that is, well, there's going to be some activation that happens in like the hip rotator muscles to some degree to make it happen. But the other thing that happens is they have to come out of this locked hyperextension position. So you're going to get this little bit of unlocking that happens at the knee joint and a bit of rotation that happens through the kind of leg from the hip, like in the socket in through there, and you'll get a much more sort of like true parallel alignment, if that makes sense. So in that position, dancers can then often again feel what muscles they need to activate in order to keep their legs straight, but not hyperextended in those positions. And this exercise is a nice one because it's weight bearing. So the one on the floor is great because it just like really gives dancers a sense of like how much hyperextension they have and then what muscles they need to activate to not exploit that hyperextension in through there. But we don't dance for the most part on the floor, or we're not so worried about knee hyperextension on the floor. So it really is in standing that we need to teach dancers how to control their hyperextension in through there. And so either using that same cueing from the floor and that same muscle activation feeling and bringing them up into standing, or this little one in parallel where we teach them how to find that neutral leg alignment in parallel and then what that feels like are great ways to start this. Then, of course, we need to then make it more applicable in different positions. So oftentimes dancers who are struggling with hyperextension are going to be dancing in turnout, depending on what styles they're doing. So whether it's like ballet or other sort of like externally rotated styles of dance. So being able to translate the same muscle activation and feeling from a parallel position into then like a first position is really important because we want these dancers to be able to carry this over into like a class setting or when they're actually participating in their dance classes. We also then need to work on dancers being able to move in and out of these positions. It's one thing to be able to just like keep your knee in that sort of neutral alignment or co-activation kind of pattern, but then can you bend your knee and go into a plie or land from a jump or do something and then find that same position and same alignment again? And that's where the training comes in. And this is why it is a tricky thing for dancers to learn. And it's a lot of work. So dancers that have this hyperextension in their knees, it is a lot of work to learn how to control and work with that hyperextension in a way that keeps their knee joints safe so that they're not exploiting that hyperextension. This is why, like I said, dancers who don't have it want it, but dancers who have it, they don't necessarily want it. They're like, this is a lot of work. It would just be easier if my knees just like didn't hyperextend this much. It's a lot of work to learn to control it. And that is also why for younger or less experienced dancers, we want to not necessarily differentiate between a supporting leg and a gesture leg because it's a lot to think about. But once dancers have really gotten good at mastering it as their supporting leg and really finding that stability in their supporting leg, then we can start to add the like layers of nuance of saying, okay, when it is your gesture leg, you may start to use some more of that hyperextension that you have available. So hopefully that has given you a little bit more insight into what exactly is happening with knee hyperextension and also what we want to do in terms of training it to keep dancers' knees safe while they are dancing. If you have questions, want clarification on any of that, have any feedback about hyperextension in knees, feel free to reach out to me. My email is in the show notes. You can send me a message on social media, Dance Physio Erika on Instagram, Facebook, all of the social media platforms. And like I said, I will try and put together a reel or something for Instagram over the next little bit so that you have some visuals of some of those hyperextension kind of cues, because I do think that it is a little bit easier to see that visually than to just listen to my audio description of that. So if you are not already following me on Instagram, again, Dance Physio Erika with a K, go follow me and I will post those in the next, hopefully week or so. But at some point, if you are following me, you will see some videos come up on knee hyperextension. All right, I'm going to wrap things up there today. Thank you so much for being here. I really appreciate your support. I know you have so many other things you could be doing with your time, so the fact that you were taking time to listen to this podcast really means a lot to me, and I hope you have a great rest of your day.